B on number 6?
I haven't read either of them.
I didn't finish reading case B. I read case A. So I don't really care, either one.
Let's just do case A then.
All right.
Okay.
Do you want me to read?
I have it right here.
Okay, go ahead.
Okay, it says Peggy, a 16-year-old client who was voluntarily admitted to treatment for alcohol addiction, is scheduled to go home on a weekend pass. On Wednesday, she revealed to me that she intends to go to a classmate's party where, unbeknown to her parents, beer will be among the refreshments served. Do I alert her parents? Do I inform the treatment team? Do I suggest the treatment team revoke her weekend pass?
All right. Well, let's go with the order. So identify the behavior. She wants to go to a party where there's going to be alcohol, but she's in treatment for alcohol addiction, so
Yeah.
that's an issue.
And then as a therapist, what do you do? What's the appropriate thing? So then I guess that leads just right into the professional relevance, that as a professional, what is your role in making sure that, not necessarily making sure that she doesn't drink because that's her choice, but making sure that she understands that that's going against what her goals are and what the treatment is striving towards. And
and she's there voluntarily, so
yeah,
it shows that she wants to recover.
Exactly.
One thing that I think is kind of important, it might go under this, it might go under the personal versus professional values, but this TRS clearly must have a pretty good relationship with the client if the client's willing to let her know.
Right.
Yeah, especially because she's there for alcohol treatment, and if she's willing to tell that this is going to be the situation she's going to put herself in, she must trust whoever it is.
And
Spill the beans or whatever.
Yeah, and so you don't want to betray that trust. So that kind of is a fine line.
Yeah, that goes right into the next one. So, like, as a therapist, personally, like, I would not want her to go because, for obvious reasons, she's trying to get over this addiction, and she's underage, so it's illegal as well, which is also the next section.
Right.
But then as a professional, like, do you breach that trust or not is really the question, I think. And if you are to breach, who do you breach to?
Yeah.
As far as just the treatment team, or take it all the way to her parents?
I'm trying to think what the laws are for confidentiality with minors.
Like, I know for a lot of things you can't, like, you're not allowed to tell their parents unless you have their consent. But I think only for certain things. I don't know.
I know that where I work in physical therapy, and we have forms that the patients have to sign, and if they're under 18, then their parents have to sign it, and that's, stating that that yeah, we can talk to their parents. If they're over 18, like we have had cases where we've had patients that are over 18, like they're college kids or whatever, and their parents have called and said, like, this is my son or my daughter, I don't know what's going on, can you guys tell me? And we've had to tell them, like, no, he needs to come in and sign a release form saying that we can tell you. And so, I mean, where we are, if it's the minor, the parents have to sign that paperwork for them, and in that it says that we can share that with the parents because they're a minor. But I guess it just really depends on the facility. I don't know if there's like a universal law regarding that, but
yeah, I think it's different because I know for like pregnancy and stuff, I'm pretty sure like your parents don't have to know if you're getting an abortion or things like that in certain facilities. And so I don't know if alcohol is as like,
is at the same level as that?
Yeah, I don't know.
Yeah, me neither. And I know with just like general confidentiality, you're not allowed to tell anybody unless they're a harm to others.
Yeah.
Mm-hmm.
And so they're not a harm to others in this case. So
Right.
unless there's a specific release form, then you don't have the right to tell anybody else.
Right.
True. So I think that covers the legal duties as well. Anything
Okay.
else for that?
Well, I think that the fact that you know that there's going to be alcohol at this party and you know that there's going to be minors there could bring up a little bit of an issue, but then again, where does that line, where do you draw that line between keeping the confidentiality and, if the party hasn't happened yet, it's not like you could turn them in,
Mm-hmm.
but
Yeah. And that's
because also
too.
what? Sorry.
That goes with the ethical. The
Yeah.
legal and the ethical go kind of hand in hand this time.
Yeah.
I think it all kind of melts together this time.
Yeah.
But
yeah. And then going back to what Alex said about it's a good idea to tell if it's going to bring harm to others, because technically even though it hasn't caused harm and it's not necessarily going to cause harm, there's a potential. It's underage drinking, and if they're going to be driving afterwards, there's all those other factors to take into consideration as well.
Mm-hmm. Definitely.
But I don't know. I feel like just as a therapist though, you don't have much say because it's all confidential stuff.
Right.
And it's not like she's saying she's going to commit suicide, because I think that has to be reported.
Right.
And abuse and stuff, but this is not, I don't think this would fall under either one of those categories.
Mm-hmm.
I agree with you.
So, action.
So
I feel like
it's hard.
even though it's a difficult situation, and I feel like the right thing to do, for me personally, would be to warn somebody or try to not make her do it. I think the best thing that you can do as the rec therapist is just kind of talk to her about her goals, and talk about how it's not a good idea to be around alcohol if you're trying to recover from an addiction. And if she doesn't listen to you, then she just doesn't listen to you.
That's her choice in the end. But then again, is that conversation, is that something that you think that should be charted though? Because if it's charted, then anybody could have access to that too. And I guess that could be a way of reporting it if anybody were to look over it in the treatment team,
But then that would still be breaching confidentiality if you're doing it inadvertently.
Yeah.
It's a breach.
Right. So that's my question. Is that if you're doing a session or whatever, and she says that during the session, is that something that you would want to chart?
I think we chart the general idea, not necessarily what she said, but just mention in your charting. We talked about goals. We talked about how important it is to stay away from alcohol, and just kind of how, a general overview of how your discussion went without saying specifically
saying she wants to go to this party that there's going to be a lot of drinking at.
Yeah.
I think it might be a good idea though to mention that she is talking about being around alcohol and putting herself in that situation, because it's an important thing to know that that's on her mind at all.
Yeah, that's fair.
So even if you're not necessarily charting exactly what she said word for word, putting the idea was in her mind is probably a really good thing to have on there, because that could affect her treatment.
Mm-hmm.
Yeah, I think you're right.
Yeah. Okay.
So what is the general consensus?
I think if there is a release form about parent information saying that they have the right to know everything, probably talk to parents. If you don't have that permission, then you just can't.
Mm-hmm. And I like what you said too, Caitlin, about just talking with her before this all happens, talking with her specifically about what her goals are and how this situation will help with those, and her thoughts about the whole process.
Yeah, because she is there voluntarily, and so
Right.
it's not like you're trying to force her from staying away from alcohol. Like, she's the one that wants to stay away from it. And so I think just reminding her, like, the reason you're here and doing all this stuff is to avoid situations like this.
Mm-hmm.
And if you do this, then it's like throwing away everything you've been working for.
Mm-hmm. And if she's there voluntarily, you don't have the ability to stop her from leaving anyways.
Exactly.
If they're there voluntarily, they can leave whenever they want. So.
All right.
Okay.
Case 1 taken care of.
Sweet.
Okay. Number 2.
Number 7. Do you want me to read it?
Sure.
Okay. So it's about competence. It says, I am a CTRS working part-time in a skilled nursing facility. I choose to work part-time because I want to spend time with my young family. One of my colleagues suggested to me that I am unethical because I rarely attend a national TR conference. He said I'm not keeping up with the field. This kind of shocked me. I want to attend the national conferences, but right now my husband and I are struggling to make ends meet and just cannot afford the travel and lodging. My agency only provides a small amount of money per year for tuition. I attend local TR workshops. I read the TR journals, which I convinced my agency to subscribe to, as well as the annual in TR. And I attend many in-services at my facility which are related to patient care. When someone I know attends a conference, I often meet with that person to pick their brain and get handouts and other information. I also visit the medical library when I'm thinking about starting a new program and get all the information I can to help me plan. I am active in our local ATRA chapter, and I am on the ballot to be a board member next year. Next month, I'm doing a case presentation at my facility to demonstrate to the nursing staff how therapeutic recreation interventions can improve the care of our patients. Next year, the ATRA National Conference will be just a half-day drive from where I live, so I will be able to go, and I can hardly wait.
All right.
So identifying the behavior, I think it's just that she's a little bit concerned now if she is, up to date with all of the continuing education, if she's compliant with everything, because she hasn't been able to go to a national conference.
Mm-hmm. Exactly. So the professional relevance, like, it all revolves around her profession, and so obviously, like, conferences are important, but I feel like she's doing all she can besides going to the conference. So
going to the conference isn't the only thing that is on the list of continuing ed. Like, there's a whole list of things, and she's doing pretty much all of them.
Yeah, it seems like she's making like a huge effort.
Yeah.
To make sure.
Yeah. I almost feel like this ethical dilemma is less about her competence and more about like relationships with coworkers.
Yeah, that's true too.
Because she seems plenty competent to me.
Yeah.
So.
Let's see. The personal and professional values. So professional values, obviously, it's important to gain information, like I just said, and like be up to date with everything. But then personal values, like family is important. And if she's doing all these other things while being able to like be at home with her family and do all of her family duties, like, I don't know, I feel like that's just as important.
I agree. I feel like in this case, she's doing all that she can in both sides to meet both, or to satisfy her personal and professional values.
Yeah.
So.
Right.
Legal duties. I think that just goes back to the
continuing ed.
Yeah, the continuing ed requirements.
Yeah. It sounds like she's keeping up, so legally she's fine.
Yeah. I don't think, I mean, I have never heard of like you have to attend conferences or
you don't.
Whatever. You have to like be doing research and stay up to date on research, but they don't talk about everything you need to know at a conference. There's more to be learn
Right.
other than what's being spoken about at a conference.
And a lot of the stuff that is in the conferences is in the journal and the annual and
Right.
all that stuff. Like,
Yeah.
there's more than one way to get information.
Mhm.
And if she's talking to people that have gone to the conferences and getting handouts from them, like I feel like that's going above and beyond what she even has to do.
Mhm.
Yeah.
She's trying her hardest. Right. Ethical obligations. So this coworker is saying that she's unethical for all these reasons, but I think he's bogus.
Yeah. I think she's doing pretty good.
Yeah.
Yeah.
I mean, ethically, it's just the same thing. Like you have to keep up with the knowledge and like what's going on in the field, but she is, so
Right.
good for
There's
her.
only so much you can do.
Yeah.
I think.
Can't be everywhere, so you're not gonna know everything that's going on in the field, obviously, but
Mhm.
Mhm. All right. Determine action.
I think she should just keep doing what she's doing and plan on going to that national conference.
yeah.
I mean, you know, not just to say, oh, I've been to a national conference, but because it will be beneficial. But everything that she's doing, it seems like she really knows how to keep herself up to date and that she is doing all that she can to do that.
Yeah. I think she needs to talk to her coworker and maybe, I don't know. I don't feel like she needs to justify herself because she's doing good and she knows she should know that she's doing good, but I would almost talk to the coworker and be like, hey, I can't go to the conferences, but look at all this other stuff that I'm doing that makes me more than capable and more than competent at my job. Like,
Right.
yeah.
Exactly. And if she's gonna go next year, it's not like she doesn't want to go to the conferences.
Mhm.
She really wants to, she just can't afford it.
Yeah.
Sometimes we just can't afford things.
Yeah.
Right, and especially where she does mention like her family and everything like that comes first.
Mhm.
Yeah.
So
Yeah.
Yeah, so I agree. Just keep doing what she's doing.
yeah.
Ignore the crazy coworker. And if it gets too out of hand, like I would just take it to a supervisor and say, look, tell this person they're not listening to me. I don't know.
Yeah.
She cares enough.
Right.
All right.
Okay. Anything else?
Nope, that's it for this week.
I think we're good.
All right.
Awesome.
Next week there's one more, but that's the last one.
Cool.
See you guys.
Bye.
Yeah, have a good night.
Yeah.